our target is to reduce the maternal mortality rate. We do not want any mother to lose a life because the mother is pregnant. We do not want any mother to lose a baby after carrying a pregnancy for 9 months. So I want to encourage the midwives and the nurses all over this country that the work you are doing, you have a reward in heaven.
Life 360.
Good morning, good afternoon, good evening from wherever you're watching us. And my name is Robi. Once again, welcome to Life 360, where we talk matters health. And today we are at Mama Lucy Kibaki Hospital, where we will be speaking to a midwife, Victor Mboya, who will be taking us through the role of a midwife. This week we celebrate midwives who have, or rather play, a very critical role when it comes to the journey of being a mother. I'm talking about through pregnancy, delivery period, and even after delivery. Now, allow me to talk to Victor, who will take us through his journey as a midwife, and also he will be able to tell us, what do midwives do? What is their role? And what is the difference between a midwife and a nurse? Something that I know most of us can't really differentiate. That's what we're about to do today. So, karibu sana Victor. Introduce yourself to my viewers and take us through who is a midwife. Then tutaulizana maswali tukiendelea, si ndio?
Yes, Robi. Thank
Yes,
you so
introduce
much,
yourself.
Robi. My name is Victor Mboya. Victor Mboya, I am a nurse midwife. I have specialized in RH, that is reproductive health, and so currently I work here at Mama Lucy as a midwife, and I'm also a TOT. TOT is the trainer of trainees of on reproductive health activities. That includes RAMCA, family planning. Yes.
So basically, Victor, for someone to hear about a midwife, people think a midwife is a woman who helps other women to deliver. But in this case, even you as a man are a midwife. So basically take us through who is a midwife and what is the work of a midwife.
Thank you, Robi. A midwife is not necessarily a woman, but a midwife is a trained professional, a trained healthcare professional who help in assisting especially women during their pregnancy period, during their childbirth period, during the postnatal period, and also after their delivery. They continue helping and caring for this mother until the baby reaches some age, especially after 5 years of age, when the baby shall have already gotten all the vaccines. Yes, so it does not necessarily have to be a female gender, but both male and female, but it has to be a trained professional healthcare provider.
So from your description, it's easy to confuse a nurse and a midwife. So is there a difference between a nurse and a midwife and their roles? Are they the same ama ni tofauti kidogo?
Yes, thank you, Robi. Basically, both of them are trained healthcare professionals, both a nurse and a midwife. But a nurse is a general term that's used to describe these trained healthcare providers, because for a nurse now does the general nursing care of the patient. That does not necessarily have to be a pregnant mother, but any sick patient that needs nursing care, that is for the nurse. But for the midwife, they are specifically trained. They have some additional training, basically for a pregnant mother, that is during pregnancy and during childbirth and even post-delivery. We call it the postnatal care. So they offer those services, and then they also offer even the counseling to these mothers.
Now, and for you personally as Victor, why did you particularly choose to be a midwife and not any other work or rather career within the health system?
Basically, when I was a young man, I'd never thought of being a midwife. Yeah, but until after high school, when I used to go to the hospital, I used to take my grandmother to this. My grandmother used to have some illness. And so when I used to go to the hospital and then I see what midwives do, what nurses do, then because most of the time I realized that in the hospital, the people who were taking care of my grandmother were nurses. Most of the time, so I could ask them questions, and then I got so interested and I was very happy with what they were doing, because I realized that they had vast knowledge on how to take care of this patient. They had a lot of knowledge in medicine. So I got the interest of, I wish that I should also one day be a midwife or a nurse. Yes.
Definitely, that's quite interesting. So now, in your line of work, what is the most satisfying thing about being a midwife?
Thank you very much, Robi. Being a midwife is very satisfying. Very satisfying in a manner that you realize that when a patient comes to the hospital, this is somebody who has the need and needs much of your care. If I start with even a patient who is in labor, this is a patient who has the anxiety of what will be the outcome. This is a patient who is in pain. This is a patient, sometimes when you even get to labor, when you get to the labor ward, and you see when they come, at some point, they appear as if they have mental problems. Some of them sleep on the floor. So when we walk with this mother a journey from that labor process, we talk to them, we counsel them, we reassure them, and then we have techniques of relieving pain. Yeah, we rub their back, we walk with them this journey. So when you walk with this journey with this mother until delivery, and this mother gets a live baby and a live mother, you walk home very satisfied. You feel that you have done such. Yeah.
Yeah.
Yeah, so it's actually very satisfying. Very satisfying.
Now, with that kind of course, the good part also comes with its fair share of challenges. Maybe you can tell us, what are some of the challenges that you encounter being a midwife?
It has great, it comes with challenges actually. Yes. Do you know this work at some point, people, like so many people may not love doing it because at some point it looks a bit of filthy work, especially during delivery and labor. You know, at this point, you sometimes the mother sleeps on the floor. Sometimes we call it a fast twin, because when they're in labor, when the labor is so intense, and sometimes they even remove feces. So you have to be gentle enough to unampanguza, that you ensure they are clean. You ensure, so at some point you'll also feel that these mothers are so bothersome, because you see they're in labor, they're in pain, and this pain is intense. It increases with intensity and frequency. The more the labor continues, the more the pain increases, and therefore sometimes they may appear very disturbing. You tell them to sit there, they don't want to sit there. Yes. Oh. So that's a bit of challenging work that is in it. Sometimes there's a lot of workload. Especially I work here in Mama Lucy. Here we sometimes have workload. This is the referral facility for Eastlands. We get all the referrals from all over from Soweto, Kayole, Umoja, Mukuru, Kwanjeng, Madar. We get referrals from all over the Eastlands. So sometimes the work can be overwhelming, can have a workload, because you realize that at some point we get to do 30 to 40 deliveries in 24 hours. So sometimes it's a bit overwhelming.
With the kind of work that you do and the challenges that you've mentioned, how then do you balance to ensure that you also take care of yourself? Because sometimes the work becomes too much and you have also to think about yourself.
Oh yes. So the first thing for us to really balance and don't feel the overwhelming bit of it is to love your work, to love what you are doing. So as a midwife, we love what we are doing. So you must accept that this is your duty, you are doing it with passion and to love what you are doing. So this has helped us much so that when we get to work, we don't feel now the workload or the burden of the work because we do what we love. It is very interesting. Working as a midwife, it's very interesting because you deal with people who are alive, people who are well, but they have pain. So even as you walk with them this journey, you are sure that it's just a while. After around some hours, you'll have a bouncing baby and a live mother. So that is the better part of it that we enjoy.
So working closely with mothers, apart from now helping them to deliver their children, how else do you support them, especially when it comes to their mental health and also their general well-being?
Thank you, Robi. Yes, this is our duty. It's our duty to walk with them this journey. And one of actually our major duty of our nursing care or as a midwife is counseling of these mothers. Because you realize that these mothers, with the moment they just get pregnant, then a lot of thoughts start to roll in their minds. So let me just bring you into now delivery, because that journey works at the antenatal care of the mother during pregnancy journey. But now when it comes to delivery, you realize that at some point a mother may come. A mother has stayed home. We call it primary, that's the delay. So a mother may stay home, not feeling the fetal heart rate, fetal kicks not there. So when they come, you realize that they come late when now the baby is not alive. We call it IUFD, intrauterine fetal death. So when they come, we do our investigation, we check our fetal heart rate. If we don't find the fetal heart rate, we take them for an ultrasound. So the ultrasound will confirm that the baby is not alive. That is IUFD. So we have to walk them this journey. This is a mother who has carried a baby for 9 months. This is a mother who is expecting a baby. This is a mother who has other issues. Maybe she has lost even more, some other babies before. So even breaking this information, breaking this news to them, it's not an easy task. But we have to walk with them this journey. We have to talk to them. We have to counsel them. We have to reassure them until they get to accept that now this baby is not alive. So we do counseling, we counsel them, we walk with them this journey. It's part of our duty as a midwife.
Now, as a midwife, I believe that you also work closely with doctors. So how does your role as a midwife and a doctor, how do both roles complement each other to make sure that you have a healthy child and a healthy mother at the end of the day?
Thank you, Robi. A midwife and a doctor, we work together. Actually, we work one-on-one. This journey, we walk it together. Because when mothers come, we first receive them. We take history. That history includes their obstetric history, the number of children they have given birth before, whether they got tetanus during the ANC clinic, whether they have done the investigations. We look at their blood level, the HB. We look at whether they have done other investigations like the hepatitis B. They have done syphilis, all the screening. So as we do this so that the doctor is just there, because we first receive them. After we've received them and we get this history, the next is the doctor. The doctor comes and take again the history in line with their duty, such that if there is any management, it's the doctor that prescribes the management, and then we as the midwife we implement. So we work with doctors hand on hand. We work together. We walk the journey together, because the doctors prescribe, they write for us the plan of management, and then we implement the plan. Yes.
Speaking to most women out here, I'm sure you've heard stories where women maybe have complained about midwives or about how they've been handled when coming to hospital. So what are some of the misconceptions that you'd like to demystify when it comes to the work that midwives do and how you handle patients that you get every day?
There's been myths and misconceptions about midwives that have always been there. You see, there's this issue that people think that when you're delivered with a midwife, then you may not get a healthy baby and a healthy mother. Of course, we work hand in hand with doctors. They are our seniors. We work with them together. They prescribe as we implement. But the one myth that I want to demystify is that when a mother is in the hands of a midwife, that mother is assured of safety. Because in case of anything that needs a doctor's consultation, that doctor is just around. But the first contact is the midwife, but the doctors are just around. For instance, in Mama Lucy, we have at every shift, we have the midwives, we have the doctors, and we have the consultant. And all of them are on duty, and they are within the labor ward. So that when a mother comes, the midwife receives the mother, but the mother is assured of safety, because in case of any need, our theater is just here, a stone throw distance. Actually, it's just a 2 minutes walk. We are in theater. So when we receive the mother, if in case of any emergency, our doctors is here, our gynecologists are here, and then we work together to ensure that this mother has a healthy mother and a healthy baby.
We are celebrating the work that midwives do throughout this week. So maybe what is your message to fellow midwives and also to mothers who are the people that you see each and every day when you come to hospital?
Thank you, Robi. This week, we as midwives, we are extremely happy because we are celebrating our week. It's our week as midwife and nurses, and we are all happy because of the work that we do, the care that we give to the mothers. You know, our happiness is always when we see a mother walking out of the hospital with a baby, a healthy baby, a baby that's bouncing and breastfeeding well. That is our happiness. So I would want to encourage other midwives and nurses that continue doing the work, the good work that you have been doing. Actually, I want to affirm to you, Robi, that midwifery is a call. Nursing is a call. So it is a work that we do passionately because it is work that you get the reward. We normally say that our reward is not here.
Yes, the reward is above.
Our reward is above. So I want to encourage the midwives to continue doing the good work that they are doing, the nursing care, the midwifery care, so that our target is to reduce the maternal mortality rate. We do not want any mother to lose a life because the mother is pregnant. We do not want any mother to lose a baby after carrying a pregnancy for 9 months. We do not want these preventable causes. There are a lot of causes that are preventable, especially in maternal child health. So I want to encourage the midwives and the nurses all over this country that the work you are doing, you have a reward in heaven. I also want to tell mothers that we are here for you. We are here to take care of you, and don't deliver anywhere outside the facility. We call it the skilled birth attendance. Let you be attended by somebody who is a professional, somebody who is a trained person, who is a midwife. And these midwives are only found within the facilities. I know there are mothers who may fear that when I go to the facility, I will be charged, I don't have money or whatever, but I want to encourage them that let them attend the ANC clinic because they are very important. If a mother realizes that they are pregnant, let them attend the ANC clinic from the time that they realize that they are pregnant.
Now, I would like you to speak to the relevant authorities, let's say your bosses, even the Ministry of Health, the county in general, the people who now make sure that environment that midwives work in is the best environment. What message do you have for them?
Thank you very much. Robi, I think I will talk about Mama Lucy specifically. In Mama Lucy, the administration is very supportive to the midwife. We have a supportive nurse service manager. Helen, yes. Oh, you know her.
I know Helen.
Yeah. So Helen is our nurse manager. She's very supportive. Actually, every morning when she reports to job, she has to work in all the departments to ensure that the welfare of nurses, the welfare of midwives, if there is any need that midwives need, she ensures that it is taken care of. We also have our mentorship program that we do continuously, and then they also earn CPD. So we have our mentorship program on reproductive health activities. So we have planned it. There's a day for reproductive health, there's a day for the medical, and even for the surgical cases. But as midwives, we have put mentors. We have lead mentors that mentors others, because you see, medicine is it changes every time. So we ensure that every time, through the support of the administration, that we do mentorship regularly to, especially when we get new nurses, new midwives, they are mentored on the updates that are there. Yes, so our administration is very supportive. We normally even have sessions where we do mental health awareness. Yes. They bring for us experts on mental health awareness. Then we are taken through mental health awareness, even financial, actually. So we even taught financial management, how to do your savings, how to plan for your retirement, and such things. So it has been very supportive.
And so, Victor, given a chance, would you change your career, or even just what you do as a midwife, to do something else? Or you decided I'll be a midwife, and it's midwifery till death do us part?
Robi,
yes.
As I told you, I am a mentor and a TOT in Nairobi County on RAMCA, MNH, and FP. This is about maternal child health. Myself, I am a midwife. and I'm a midwife. I am a midwife and a mentor. So what I love most is to mentor people so that they can do much better in midwifery. So Mimi, I am a midwife. I am a midwife to be, and I will be a midwife through mentor. Even in my next life.
And of course, I wouldn't want us to end this conversation without asking why most men fear to go into the labor and delivery room with their wives. So, and with your experience here, what would you say about that? Is it okay? Would you advise men to accompany their women in the delivery room? And what have you seen in regards to that?
So, that is another misconception that actually I was supposed to demystify.
Yes, please.
Yes. We normally encourage, actually from the ANC clinic, we encourage that family, the support of the husband. Yes. And if, in fact, when they come to the facility at the ANC, those who come as a couple, we give them the first priority. Because you know men sometimes do not love staying much in the hospital. We give them a first priority. Now when I talk about labor and delivery, we encourage that support of the husband very much. And research has it that when the husband is there, present, the outcome is always very good. Because they get that support. And sometimes we just don't allow them because of our privacy. But we have curtains for every bed. When we walk to labor room, you will see. And we ensure that a mother walks in with the husband. So that even when the mother feels pain, then the husband is supposed to wrap the back.
Yes.
So that, oh, you have the experience of the same. So that they don't feel that a lot of pain. We have realized that when they have that support of the husband, the outcome is always good. And therefore, I encourage all men to accompany their wives to the hospital, especially during delivery and labor. And when they come together, we allow the husband to walk in with the mother, so that even when the baby is delivered, the first person to cut that baby is the father. And that's when the bonding starts. That's where bonding starts.
Tell them.
That is when bonding starts,
Yes.
Robi. Yes, and we really encourage that. It's something that we are really encouraging, and the outcome is always good when a mother gets a support of the husband.
So thank you very much, Victor, for talking to us, and we really, really appreciate your work as a midwife and your fellow midwives who we celebrate this day with. Thank you very much. So to our viewers, just to give you an overview, as I mentioned before, we are at Mama Lucy Kibaki Hospital, and we've been speaking to Victor, who has told us that in a day, averagely, it's possible for a midwife here at Mama Lucy to see at least 10 women, or even more, sometimes even 30, because the number of women who come here to deliver is a huge number. Now, remember that this is just Mama Lucy Kibaki Hospital, but midwives are in several parts of the country in different facilities. And as Victor told us, it's important for you as a woman when you're about to deliver, or even when you're pregnant, visit a facility and start your journey with one midwife. Now, as we celebrate the Midwives Week, I'd like you as a mother, as a parent, or anyone who has had a chance to interact with a midwife, give them their flowers. Imagine having to deliver 30 babies in a day or more for women who have twins. It's a big number, and they're doing a great job. We celebrate them, and we appreciate it. We appreciate the good job that they're doing in different ways, and may they continue to do the good job that they're doing. So allow me to end it here. Thank you very much, Victor. Thank you to Mama Lucy for gracing us and for having us here. Until next time, bye.